Good morning, good afternoon, good evening, good whatever time of day it is, wherever you are right now. Thank you for tuning in to the Conversations with Dr. Don show. The show is produced and broadcast from the Portland, Oregon, USA area. And for your first-time viewers, Conversations with Dr. Don is an ongoing series of one-hour standalone talk shows where I interview interesting people like most of you out there about who they are as unique, one-of-a-kind individuals and about what we've decided to talk about. Tonight we'll be talking about where have all the mad-as-hell doctors gone? Where have all the mad-as-hell doctors gone? Yeah, good question. So tonight my guest is Dr. Eugene Uphoff, MD, who will talk to us about, have all the mad-as-hell doctors gone?
It's great to be here. Thank you for inviting me.
Yeah, how you feeling?
Well, I'm feeling fine. You know, you asked that. The mad-as-hell doctors haven't really gone anywhere per se, but we have sort of branched out into other activities.
Yes.
I was thrilled that you asked me to come join you again because, as you probably recall, it was just 10 years ago that the mad-as-hell doctors left Portland, Oregon to travel across the country to D.C. to try to influence the legislation that was being proposed for healthcare reform.
Yes.
And the beginning of that protest that we did occurred right here in this very building, right after your show. We sat down, the group of us who were sitting here and who had been talking about healthcare reform, and with some encouragement from Adam Klugman, we said, we ought to be doing something about this and not just talking.
Adam Klugman.
And so what we did was we organized what we call the mad-as-hell doctors. The name, you may recall the movie Network.
Yes.
Probably 20-some years ago.
And we're not going to take it anymore.
And we're not going to take it anymore. And in it, the actor, Peter Finch, is so fed up with the way things are that he encourages all of his viewers to go to the window, open it up, and yell out, "I'm mad as hell and I'm not going to take it anymore." So that was where the name came from.
Yeah.
And our trip actually left from Portland September 9th, traveled up to Washington, across Montana, down to Wyoming, Colorado, across Nebraska to Iowa, Minnesota, Wisconsin, Illinois, Michigan, Indiana, Ohio, Pennsylvania, Kentucky, Tennessee, ended up in Washington, D.C. And there we had a rally in Lafayette Park across from the White House. Great turnout. Along the way, we had about 45 town hall meetings at various locations, and the total were probably 6,000 people when you add up all the people who attended those.
And you know, we're getting into the second half of the show because the first half is a bio half, where we talk about you personally.
Okay.
And then in the second half, we'll get into the details of the mad-as-hell doctors like that.
Well, you asked where they've gone, and that's a great question because after we got back, and unfortunately the healthcare legislation that came out was the Affordable Care Act, which did not really meet our goals of having everybody in the country covered by insurance, having it be more accessible and less expensive, and getting better outcomes. Basically, more care for better care for more people for less money. So that's what we hoped for. But those of us who were part of the mad-as-hell doctors, to answer your question, have gone on to do other activities. We have a local Physicians for National Health Program group, which meets every month, and we bring speakers in to talk about healthcare reform. We go out and talk to church and political groups and so forth. So we're staying very active, and the docs down in Corvallis are doing the same, and those over in La Grande the same, and we're just continuing to beat the drums to get better health care.
And we're going to get their names mentioned in the second half of the show and more details about
Great.
Yeah, bring us all up to speed as near as we can. 10 years ago.
10 years ago, yep.
Okay, now the bio section is, and as you know, I ask a question, and if you don't want to answer, you can say, I don't want to answer. Remember that 10 years ago? Yeah. Okay, if I were to ask your best friend, who is Gene? What would your best friend say? Be your best friend. Gene is?
Well, I would say most people think of me as somebody who is dependable, thoughtful, and conscientious.
Would your best friend say that?
Yeah, I think so.
Be your best friend.
Mm-hmm. Yeah, I think so.
Gene is?
Oh, I would say he's thoughtful, he's conscientious, he's consistent, he's dependable. I have a little bit of a sense of humor, but I tend to like sort of subtle wit rather than slapstick.
Yes. So, and when and where were you born?
Born in Wisconsin.
Wisconsin.
Yep.
My wife's from Wisconsin.
Yep, in Madison General Hospital back in 1942, so that puts me at 77 years old, which is hard for me to imagine, but I guess, the calendar doesn't lie.
Yeah. So,
grew up on a farm. My parents had a farm just south of Madison. Actually, the town closest to us was Oregon, Wisconsin. They call it Oregon back there instead of Oregon. So I could tell people I'm from Oregon, an Oregon native, as long as I pronounce it right.
So, why were you born? Why?
I think it's an accident of nature.
Is there some other thing out of the blue that's some motivation from on high or whatever that why you were put on this planet?
I don't think so. I will tell you my parents have had a lot of motivation and certainly had a big influence on who I became as I grew into adulthood. My parents were both very active in political activities back in the 40s and early 50s. Mm-hmm. My father ran for governor of Wisconsin twice as a socialist. He ran for the U.S. Senate.
Socialist.
Absolutely. My mother ran for Congress.
Really?
Now, mind you, none of those elections were successful as far as that was going. But they did raise the consciousness, I think, of some people.
So they were successful.
I think in that sense. And, of course, all of us as sons, I have 3 brothers, so we're 4 boys in the family. And we were all named after politically pretty radical people. I was named after Eugene Debs, for example.
Eugene Debs, of course.
And my older brother is Norman Thomas Uphoff, named after Norman Thomas. So it kind of goes through the family that way.
Wow, through the blood, through the genes.
So I think it's a genetic trait. And of course, that meant that when I went to college and started getting active in political activities for the Student Peace Union and Students for Integration and so on, I was involved in a lot of those pretty radical or certainly liberal activities. I spent 6 months in jail in Mississippi, for example, as a freedom rider in 1961.
Wow, man. My hat's off to you.
Thank you.
Wow, you really paid your dues.
It was an important thing to do at that time. It was just they sent out a call asking students across the country who had their summer free if they could come and spend it in jail. And we said, we're going to do it.
So Wisconsin, So anything significant about your racial cultural heritage that's worth repeating?
I think it's mostly a philosophical or social kind of consciousness.
Sure.
My mother, I remember when I was even very little, would always say that one of the things we had to do was leave the world a better place than we found it.
Yeah.
And I think those are as good words as any other.
Yeah, a better place.
Yeah.
Is that going to be happening tomorrow or next year? Or is it a better place?
Well, I don't know how. I think little by little, I think we made some progress. If you think back to the days before the Civil Rights Law was passed, segregation was kind of the rule in the South, and that has changed. Like Jackson, Mississippi, where we spent time in jail, has a black mayor, black police chief.
Yes.
Things have changed.
Of course.
So I think, it's
thanks to
it's not
guys like you.
It's not as fast as I would like to see, but I think it's making progress.
Yeah. Yeah. Okay. Religious preference. Do you have a religious preference nowadays?
Kind of mixed. My dad was raised as a kind of a conservative Protestant church in Wisconsin. My mother was raised Catholic, but she actually left the Catholic Church over the issue of the book list, the books that you were not supposed to read because they were considered too
I left Catholicism for similar reasons.
Yeah. But we kind of fell in with the Quakers, and that seemed to stick.
Yeah.
So, I consider myself a Quaker.
Okay. And you have a medical degree, of course. And
I
talk
do.
a little about your education.
Well, that was kind of fun, actually. So when I started college, we had moved to Minneapolis, and I started college at the University of Minnesota thinking I was either going to be an aeronautical engineer, because I had liked building model airplanes, or I thought about being a photojournalist, because I had been a photographer for the school yearbook. Well, it didn't take long for me to be disabused of both of those ideas. My first day of class, I went down to the office of the Minnesota Daily, the student newspaper, offered to be a photographer for them. They said, sure, here, go take a picture of a parking lot because we have an article on the parking shortage. And I thought, that doesn't sound very exciting. So I took a whole roll of film of pictures of the cars all crammed together. They printed one, but it wasn't very exciting. My next assignment was to take a picture of a lecturer at the Northrop Auditorium, who was a guy from Harvard Business School talking about some theory. So he sat up, I don't know if you've ever been in Northrop Auditorium. It's a 2,000-seat auditorium. It's where the Minnesota Orchestra plays. So here's this guy up at the front on the stage. There's maybe 150 people in the first few rows. And I'm sitting there with my tripod and a long lens on it, trying to focus on him. And he read his entire talk and only looked up twice during the whole hour that he gave his talk. I got one of those pictures with him looking up, but I thought, this is not gratifying.
No.
Anyway,
no.
so he asked about medical school. So
Yeah.
halfway through school, the end of my sophomore year, I went to the counseling bureau and said, look, I've been taking art history, I've been taking music theory, I've been taking astronomy, I've been taking all these various classes. I don't have a major. What should I do? And they said, well, we don't know. Come on in and take these tests. So I spent a whole day taking all kinds of tests on interests and aptitudes and stuff. When I came back in 3 weeks, they said, have you ever thought about going into medicine? And I said, no. And they said, well, these tests aren't always right, but we think you would probably be very happy with a career in medicine, and you should go talk to somebody. So I thought, okay. And I had taken one of those required health classes, that you have to take when you're in school. And the lecturer was the doctor who was the head of the health service, and he was a really good teacher. So I went over and talked to him, and he was encouraging. So I said, okay, I'll do it. So the next 2 years, of course, I had to take all my math classes, all my science classes, the biology, the chemistry, and it was quite a change, I can tell you. But it was clearly what I was meant to do with my life.
And you could tell then?
And I could tell then. In fact, the first day of medical school, we sat in this big auditorium, probably 110 students in the class I was in. And we sat there while the dean and the assistant dean and the department heads all gave their little talks about what we were going to do in the next 4 years. And I had this odd experience, and I frankly can't tell you if it actually happened. But what I remember was, while I was sitting there, suddenly the lights in the auditorium got very bright, just incredibly bright, like somebody turned them up to a 10. And it lasted a few seconds and then went back to normal. And I looked around, nobody else seemed to notice. And I thought, did I just imagine that, or what was this? And I cannot tell you with any great confidence as to what happened, whether I was having a minor seizure, whether they actually turned the lights up, whether it was a spiritual experience or whatever. But what I knew was I was in the right place.
Did you have any more experiences like that?
Never did.
Your life?
Never did.
I'll be darned.
Only time. Only thing is that when all of my classmates were grumbling about how horrible it was that we had to take this neuroanatomy test on Friday, I thought, this is so much fun. This is so interesting. And so, yeah, I mean, it was clearly the right thing for me to do. I was lucky. I think of all the people who go through their lives never having the good fortune of being able to end up doing something that they really love.
And you loved your medicine.
I've loved it. Now, I don't love our healthcare system. We can talk about
We
that.
can talk about that.
There's some problems with America's healthcare system. We can do better. As my one of my doctors in my practice clinic used to say, he said, this wheel has already been invented. We don't have to reinvent it. There are other countries that have invented this wheel and they know how to do it.
Better than we do, huh?
Better than we do.
Yeah.
So.
Okay. So, in other education, you don't need any other education to qualify you or define your interest. You already found your.
Well, I have
charms
found
you.
that. I do continue to be interested in just about everything. I love watching OPB, public broadcasting, the NOVA programs. I find myself interested in just about everything. There are very few, maybe not so much popular culture. I can't tell you who the hottest singers are or the newest bands. I think my awareness of bands pretty much stopped with the Beatles.
How about the internet? Are you
Oh, yeah.
charmed by that?
Oh yeah, I spend a lot of time both writing things with the internet. In fact, not just on the internet, but I've actually written 2 novels and a stage play along the way as I've gone through. Of course, with medical related themes, of course, since you have to write what you know about. But well, it's fun. There are just a lot of fun things to do in the world.
And you're still enjoying it.
And I still enjoy it. Yep.
Yeah. So, and you've given up your practice.
I stopped practicing. Yeah, my wife died in 2013, 6 years ago. She had breast cancer, and I thought at that point, I was 71 years old. I thought, if I keep going to the clinic every day, I'm going to resent the fact that I'm not spending more time with my kids and my grandkids. Probably time to hang it up. Plus, it also gives me more time to work on healthcare reform. So it has worked out well. I have not been bored.
Yeah. So you've not been bored, and your wife passed away not too many years ago. And do you have a companion, a boyfriend, a girlfriend?
I have a girlfriend, yeah. We spend some time. She's smart, she's funny, and we like to do crossword puzzles together and watch documentaries. We're not so much into the, Miami Vice kind of cop shows and things, but we do like documentaries.
Do you have any pets?
I did. My dog Sugar died about 5 years ago. We had liver cancer and had to be put down.
Oh, yeah. Too bad. And children?
I have 2 kids living in Portland, and then Donna, my wife, had 2 kids from her first marriage. So we've got basically 4 kids, families, and their grandkids here. So it's great. Mm-hmm. And there are none of them off in New York or Florida or someplace else where I'd have to fly across country to see them, and end up having them over for dinner, almost every week. Mm-hmm. It's great.
Do they like you?
Yeah, I think so. I'm not worried about it. We do a lot of stuff together.
Yeah, we have a few clues, as your comments a little earlier, about your political persuasion.
Yes, you could say that.
Quaker, socialist, and Eugene Debs, and your credentials are just immaculate. You're like Bernie Sanders, do you?
I think Bernie's a very, very good guy. I like him a lot, and one of the things I like about him is that he has been unwavering in his commitment to the public good. A lot of people try to jump on the bandwagon, and particularly we talk about, Medicare for all right now, and a lot of people have sort of adopted that slogan because it strikes a responsive chord to people, even though there's not general agreement by a lot of those candidates as to what Medicare for all really would mean. For some people, they're talking about it as, well, they would just get Medicare as it stands now. For others, like if you look at the bills being proposed by Representative Jayapal up in Washington or by Bernie Sanders, those are bills that actually would improve on Medicare a lot by including dental and vision care and so forth. Mm-hmm. So there's not general agreement. Some people just say, well, let's just let anybody who wants to buy Medicare. And there's been
by capitalism.
Yeah, and there's been a
raises its
lot of
ugly head.
exactly. There's been a lot of debate about whether there would be any role in the future for private insurance companies. You know, the Aetnas and the United Healthcares and so on in the future. and we can talk about that if you like. I think there's lots of reasons why private health insurance has no role in providing insurance for health care.
Social responsibility as humans are supposed to have.
We would like to think so.
So we have established that you are on the left end of the continuum.
Oh, yes.
Yes, yeah.
Although interestingly, you know what I would say? There's a lot made about left versus right, the liberal conservative kind of things. And I read an interesting book that suggested we should turn that on its end and think of it economically as those who are at the bottom and those who are at the top.
I never had it put that way before.
In terms of what their political persuasions are. Because the people who are at the top, who we would think of as being the right, they're the ones who have a lot of money and want to keep it as much as they can. The ones at the bottom don't have much, and they don't have much political power.
The ones at the top would tend to be more capitalistic in America.
Yeah. They tend to have more of the wealth. You know, the estimates are that 1% of the people in this country control half of the country's wealth. That seems not very fair.
Fair.
Yeah.
Are you a tree hugger?
No, no.
I think you are.
Yeah,
a
no.
closet tree hugger.
No. I like trees, but yeah.
Sure, yeah.
I like trees in part because they keep us better supplied with oxygen and burn up some of our CO2, which frankly we can all use help with right now.
Yeah, and the Amazon.
Yeah, the Amazon forests are really, those fires are just horrible.
Yeah. So, memberships in political, social, or civic organizations, do you belong to any of those anymore?
Good question.
Yeah, worth mentioning to the
I think
viewers.
so. No, I think my organizational activities are really primarily through the Physicians for a National Health Program. We have a local chapter.
Physicians for a National Health Program.
Right.
Mm-hmm.
And we have a
I belong to that one.
we have an active chapter, and I think it's been great.
Okay, yeah. So, any others come to mind now? Or?
No, I mean, I have a lot of sympathy for people who want to help, support the Humane Society and the food bank and all of this, and make contributions to those, but I'm not actively involved as a member.
Yeah, I can see in your eyes there's an appreciation for what they're about.
Yeah, there's enough tasks in this world, in this country, for anybody to spend, 48 hours every day doing things that help make the world a better place, as I would say. And we just don't have the energy. We have to pick and choose our battles, as somebody once said.
There's a few clues about earlier on as we were talking. And the next question is, the persons from the past or alive today that you particularly admired or look up to? Anybody comes to mind from history or alive
at the
today?
top of the list. I'd put my parents.
Mm-hmm. As a capitalist, you said?
No, as a socialist.
Okay.
I mean, my parents were both of them very active in progressive social issues, and my mother lived till just past 100 years old.
Wow.
And so I'm hoping I got some of those genetics and I can keep going for a long time.
Yeah. So you admired your mother?
My mother and father both were really active. Like I say, they both ran for office. They were both active in political campaigns. When they stopped running for office, they continued to be active, in political campaigns. They were very active in the peace movement, especially during the war in Vietnam. Spent a lot of time doing protests there and organizing. But there's enough things for people to do. You don't have to pick any one thing,
Which of those two hugged you the most? Your mom or your dad?
Probably my mom, I would think. Probably more.
She hugged you a lot?
I don't know about a lot, but normal amount, I think.
Okay.
She taught me how to make bread.
I'm looking for the socialistic tendencies of where they came from.
Oh, I think just by demonstration. I mean, if you think of, you can tell people about something. You can give people instructions about how to act, and you can suggest to them that this is what a society expects of them. But it's way more powerful if you demonstrate that, if you carry that out, if you act the way you think people should be. You know, there was an old saying, you probably have heard this, that somebody say, you know, what you do and how you are sounds so loudly in my ears I cannot hear what you say. Which means it speaks to the question of how much hypocrisy can we tolerate before we say, oh, wait a minute, you're telling me one thing but you're doing something else. It's kind of like the parent who says to their teenager, oh, you should never stop smoking. I wish I'd never started. And it's like, well, so why don't you stop?
Did I ask you about a religious preference?
You did. Quaker.
Yeah, of course.
Yeah.
Okay. How could I forget that? Yeah. So, and you appreciate your mom and dad and any other people from history that perhaps are gone now that you look up to or admire. There's somebody who inspired you
Well, I mean,
to go to the civil rights of the South.
Well, that was just being involved in the political organization, the Students for Integration in Minneapolis, and yeah, that was all the people that I worked with. I would suspect my namesake probably has something to do with that, Eugene Debs. You know?
Oh wow, man!
I would say that probably being named after him presented a challenge to live up to that level of commitment for social justice.
Social justice.
Yeah.
Where is social justice today in our country?
Well, I think we could use some more of it.
All right. It looks like it's going to be time for us to take a break, and then we'll come back and talk more specifically about where have all the mad as hell doctors gone? Where have all the...
Yeah.
Let's take a break in there in the control room, please. So terrific. So let's go on with the second half of the show.
Okay.
And I'm enjoying you so much. I forgot how.
It's always fun to just have a chance to talk about things that are important.
Yeah. So looks like we're back. And I want to thank you for staying tuned. And for you viewers who missed the opening of the show, Conversations with Dr. Don is an ongoing series of 1-hour standalone talk shows where I interview interesting people like you, like most of you out there, about who they are as unique, one-of-a-kind individuals, and you are quite unique, and about whatever it is we've decided to talk about tonight. And we are talking about where have all the mad as hell doctors gone? Yeah, and we're going to get into that. And Eugene Uphoff, MD, yeah. Welcome again.
Thank you. Thank you. It's great to be here.
Okay, so let's start into some of these questions here. Who were the mad as hell doctors?
You know, as we were talking about it earlier, I was thinking, how well have I kept in touch with them all? And I haven't actually been in touch with all of them, but they were. The two organizers were Gary Jelinek and Adam Klugman, who just did a great job of helping to pull through the sort of practical aspects of our tour across the country.
And I remember them.
Yeah, they're great.
Because that was earlier on.
The docs were Mike Huntington from Corvallis, Paul Hochfeld, who was an ER physician in Corvallis, Sam Metz, an anesthesiologist, who I know has been on your show as well.
A lot of times.
A lot of times, he's great. Bob Seward is a retired internist in Forest Grove. He's actually from Minnesota, or excuse me, from Wisconsin originally. Joe Eusterman is a retired doc who had worked in internal medicine, and I think he was also a rehab doctor for a while. Peter Marr, who is the president of our Portland chapter of Physicians for National Health Program. He's a family doc, great guy. Mark Sapir was from California. He came up and joined us. Bill Aiken was I have to look at my list now. Bill Aiken's a nurse who was with us. Catherine Ottaway was a family doc from up in Washington who joined us there when we went up that direction. Margaret Flowers is a pediatrician retired who's working on healthcare reform, and she joined us when we got to Washington, D.C. Mm-hmm. And we had others helping us along the way, non-physicians. Bill Whitaker and his wife Cheryl from LeGrand helped us, and it was a great group. And we had this caravan. We had, I think, 5 or 6 cars and the big Winnebago van that we had covered up with slogans, you know, this fall the rubber gloves meet the road, you know, single payer health care for all, so on.
And I remember I was honorary, somehow included because I was a PhD clinical psychologist. Mm-hmm. So you guys excuse me.
Absolutely.
Early on, and I was right there with you.
And you know, the trip, I think, had a lot of impact on people we met along the way. We had 45 town hall meetings along the way, and really had a good chance to talk to people. One of the things we did at each of these meetings, after those of us who were up on the stage would give our mad as hell moment, we'd talk about why we were mad as hell, about the current medical system, and then we would invite members of the audience to come up and take a minute to give us their experiences with healthcare systems. And it was tragic to hear some of the stories. One of the guys who came up to the microphone up in Washington, Washington State, told us that he had been fired from his job, a company, I think there were 13 employees in his small company, and he was fired because his wife got MS. And his boss told him, the owner of the company said, if I keep you on for the healthcare coverage, it will triple the costs to our company. And I can't.
Insurance companies.
Yeah, and I can't do that. So he lost his job because his wife had MS, which is obviously no fault of hers, but that's because we have a system that does not take care of people. And you know, we made that point all the way. I think I may have told you at one time about an experience I had where one of my patients came in to see me in the clinic, so happy that George Bush, President Bush, and Congress had flown to Washington the prior weekend to pass a bill to save the life of Terry Schiavo, you know, the woman in Florida who was in a coma for 15 years. And of course that their bill was passed, was declared unconstitutional, and she was allowed to die. But I said to my patient, I said, no, it wasn't fine that they did that. If they had really cared about it, they would have flown back to Washington last weekend and passed a national health insurance that would cover everybody. And we would have saved 18,000 people from dying last year.
Profit.
If we had done that. But anyway, so we all had our mad as hell moments as to what things we were really ticked off about. And it was fun. We had good camaraderie. We made lifelong friends along the way, so.
And you remember all those names?
Mm-hmm. Well, it took me a little while to get them all down, but I did.
All right, yeah. And caravan. Say a little word about caravan, a little more.
Well, it was just because we had, the Winnebago, of course, was our flagship, so to speak, and then we had 6 cars or 5 cars that had the rest of the members of the group traveling along together. Uh-huh. So we'd have conversations, you know, because when we were driving this whole big long route to get out to Washington, D.C., it took 6 weeks, so we had a lot of chance to visit along the way.
Fond memories, huh?
It was great, yeah.
Yeah.
Would have been greater if we'd been able to convince the Congress to pass a national health insurance, but
We're still working at that.
we're still working on that.
Yeah.
There are actually 2 bills right now in front of Congress and the Senate that, although I'm not overly optimistic they'll get passed this time around,
Especially with the present administration.
yeah, but there is a lot of interest, and if you look at the polls right now, over 60% of Americans, if you take all of the parties together, and it's like 90% for Democrats, think we should have a universal health care system that covers everybody. Government funded.
So what does it matter what the citizenry thinks if they've got to pass through the system and the corporations?
How much time do you have to talk about that? Yeah, I mean, There's a wonderful, cute little poem, though, by a Danish poet named Piet Hein. The poem goes, "Problems worthy of attack prove their worth by hitting back." And this one hits back.
Yes.
So it makes me think, yep, it's probably worth going after it.
Yeah. So we talked a little about what has happened to the Medicare doctors.
We sold the van, by the way. We sold the Winnebago.
It should have been a memorial or something.
Well, you know, we had a hard time making that decision, but yeah, we got to D.C. and thought, well, we're not really going to drive it back 3,000 miles back to Oregon, so let's see if we can sell it, and we did. But
I see the sadness in your face as you're
a
smiling
little
through it.
sadness, it's true. I have some great pictures of it. It was quite a machine. The only time it really got scary was driving it along the southern edge of Lake Erie, and the winds blowing in off the lake made that thing just rock, and holding that on the road was a problem.
Yeah. How has the movement to reform America's health care changed in the past 10 years? Has it movement changed?
I think it has, and in a couple of ways. And that's a great way, I think, to look at it as a transformative sort of thing, because what has changed is, number one, things have gotten worse. You know, we have more people dying. We have more people now who are either uninsured or underinsured. Even with the Affordable Care Act, the so-called Obamacare, there's still 28 million people who don't have health insurance in this country.
And that shouldn't be.
And there's probably 32 million who are underinsured, which means that, yes, they have insurance, but it won't cover them or protect them in the event of any kind of a significant
But the statistics don't reflect that as well as it should.
Well, it's partly that.
Underinsured, what does that mean?
Well, so part of the thing is that people think that if you were able to buy an insurance policy that you covered, but you know, remember, you're only one illness or one layoff away from bankruptcy, because when we have private insurance tied to employment, what it means is that the person who's working at maybe a lousy job, or maybe has a child or a spouse who has an illness, they can't leave that job.
No, they can't.
Because they have to keep that insurance. And if the company cuts back and has layoffs, they're in danger of losing it. And that shouldn't happen. We should have everybody covered no matter what, so that if you wanted to move to Las Vegas, you could do that and you would still have coverage.
Can we regulate the insurance industry such that this doesn't happen anymore?
It turns out the track record shows we can't.
Yeah.
You know, people have been saying for years, gee, if we just have competition between insurance companies.
Genuine competition.
Yeah, genuine competition, that it'll reduce the cost. Well, it turns out it doesn't. And there's some sneaky things behind this. And the one I want to maybe focus on that I think is, maybe it's a little tricky to understand, but I think it's so important. You may know that the Affordable Care Act, Obamacare, requires that every insurance company must spend at least 80% of the money they take in premiums as benefits. Okay? They have to do that to meet the requirements of the law. Well, it turns out insurance companies have figured out some sneaky ways to get around that. One of them is that they reclassify a lot of the things they do as clinical benefits or clinical programs. So when they're doing reviews of doctors' billings, for example, which for them is just a way of getting out of paying claims, but they say they're doing the reviews for its quality assurance. Okay, and therefore they're claiming it as a care expense rather than administrative expense. That's pretty sneaky, and I don't like it. The other thing that happens is they don't actually reduce prices. For them, if they pay a hospital more for an MRI scan, that's great because that means they can put more of that money there and charge that off as an expense of business, which means they can also then pay more to their CEO because they're going to easily fall within that 80%.
CEOs.
It's sneaky. It's sneaky. And yeah, I have no trouble with a clinic or a doctor saying, hey, you know, I want to be able to make a good enough living to pay off my medical education debts and to pay my salaries of my employees well and so on. And I'd like to have some profit so I can take a vacation in Hawaii. That doesn't bother me. What does bother me is when an insurance company is making money by financing health care. To make a profit on the financing of health care adds nothing at all to the quality of the care. All that does is siphon off money to line the pockets of the people who run the insurance companies.
Administrators.
Yep. We spend almost $500 million a year on administrative overhead in our medical system. Every doctor in this country spends, on average, $98,000 a year per doctor just to deal with insurance claims, to try to get insurance companies to pay them for services that they do.
What about the successful systems in the northern European countries?
Well, lots of other places do better. For example, it costs about a quarter as much money in Canada to process insurance claims as it does in the United States. Here, in this country, we have, in most hospitals, if it's a busy urban hospital, have one billing and administration collection person for every patient bed.
There's something
that's unnecessary,
missing here.
You know? It's crazy. The overhead we have in our system is just embarrassing. And it's unethical, I think.
Of course it is.
We should be spending that money on taking care of people and not providing a big administrative structure. Medicare only has around 3% of the total Medicare premiums, the Medicare funds that get paid in. Only about 3% is spent for administration, compared to 28 to 30% for private insurance companies. It's crazy. Doesn't have to be that way.
I can't think of the primary, one of the important books I read years ago about what we're talking about now at healthcare. Softcover. He did research with looking at...
Oh, you're thinking of The Healing of America?
Yeah.
Yeah, T.R. Reid's book? Yeah.
Yes.
Yeah, excellent book.
Well,
just outstanding.
Yeah. So, so healthcare reform has changed in the past 10 years. How has it changed, really?
Well, it's changed a couple of ways. One is, the sad part is, I think people are tired of talking about it.
Yeah.
You know, and people are getting sick of it. They want it fixed, and they want it done right. So that's why you see poll numbers now showing that between 2/3 and 3/4 of people think, yeah, it's time to have universal health care, you know, government-funded, government-financed health care. Let me talk about one of the things that is my pet peeve right now, if I may.
Yes.
If you watched the early Democratic debates, one of the questions that Lester Holt asked the panel, when he asked all of the candidates on stage, how many of you would get rid of private insurance in order to have a national health insurance plan? Bernie Sanders, of course, raised his hand. Elizabeth Warren raised her hand. Can't remember now if Cory Booker did. But anyway, but most of them did not. Most of them are not willing to get rid of private insurance. And the reason the question was, when Lester Holt asked it, how many of you would have a government plan instead of private insurance? And it turns out when you ask the question that way, government versus private, that it changes how people think. If you said public versus private, it turns out the polls come out very differently, and that people are very happy to have public insurance, but they don't want government insurance. And the conservative left has learned that the word government strikes a negative code, kind of a chord in people's minds. Now, if we want to say government controlled insurance, that's fine, but then we should not say private, we should say corporate controlled insurance.
Are we going to ever have socialized medicine in America?
I don't think so, and I don't think, I'm not even advocating that. Because socialized medicine occurs in only 2 countries in the world.
Mm-hmm.
And do you know what those are? Spain and England.
Yes.
Where in socialized, well, we actually have some in this country, the VA system.
Yeah.
But socialized medicine is where you have not only all of the funding, the payment, the financing is done by the government, but the government actually provides the services. So the government owns the hospitals, hires the nurses, pays the doctors, buys the equipment, does all of this.
And why not?
And it's fine, and people in England like it just fine and think it's great. Then they grumble about it sometimes, but heck knows, we all grumble about it. But when we talk about a single payer national health plan, what we're talking about is having a single public entity, which would be set up by congressional statute through either the House or the Senate bills. We could talk about those if you like. But what that would do is set up a public funding that would take all of the funds currently being spent, whether it's VA or private insurances or some of the workman's comp, all of the funding that goes into healthcare, put it in a single agency, which would then pay all of the private hospitals and doctors, so that if I were still in practice, I would still be getting paid, except instead of dealing with 400 different private insurance plans, I could deal with one entity, and that one entity would be the one that I would send bills to and get paid by. I have a friend in Canada up in Saskatchewan who is a family doc. He and a partner have a small practice. And you know what they do? They have a half-time bookkeeper, is all they have for their practice. And once a month, she puts a disk in the computer and runs a little program, puts all of the data on. She takes it down to the health plan office, and they get a check the next day. That's the level of overhead that they deal with, which is a piece of cake. We should be so lucky. A third of all of the insurance claims that we submit in private practice get rejected first time around.
Yeah.
No, it's not covered, or no,
it provides employment for those people. Yeah.
It's we can do better. This wheel has already been invented. We don't have to reinvent it.
Am I going to live long enough to see us doing better?
There was a time when I thought it would not happen in my lifetime, but I will tell you, with the enthusiasm that has come out of these debates, I think particularly Elizabeth Warren and Bernie Sanders, I would not be surprised to see it happen in my lifetime. Especially since we're going to live to 100, so. Or at least that's my plan.
So how's your health nowadays?
It's fine. Mm-hmm. It's fine, yeah.
Yeah.
Yeah, I had a climbing accident on Mount Hood 35 years ago and broke my neck, but I survived it.
Really?
So, yeah. But I survived. The only problem is now my neck is kind of like I've got door stops on each side, so I can only...
Yeah. I've been there.
Only go a certain...
I didn't break my neck, but I've been there.
But otherwise, I'm fine.
Mm-hmm. Yeah.
And I'm in this battle for the long haul.
Mm-hmm.
Because it's not going to be an easy
What are we going to
one.
do about the present administration, the cult of Trump?
You'll just vote him out of office. That's easy.
Voting him out of office is easy?
Yeah.
Well, what about campaign contributions and the moneyed interest?
We'll get him out.
Keeps those people in office.
Yeah. we still have to have individual people voting, and I can tell you, my prediction is that the turnout among independents, Democrats, and disaffected Republicans is going to be so massive in 2020 that Mr. Trump can go back to Mar-a-Lago. If he can still afford it.
So how much do you think things are going down the tubes or in the wrong direction since he's in office compared to previous administrations?
Well, in some respects, and I know this sounds crazy, but in some respects, I think his executive decisions have made the likelihood of passing a significant, serious healthcare reform bill higher. I think he's made it more likely that people will say, no, wait a minute, this is a mess, we need to do it right. You know, the Republicans tried, ever since the Affordable Care Act was passed, they tried time after time after time to repeal it. And it wasn't even that great a bill. It's true, it did cover some people that wouldn't have had coverage, and it allowed kids to stay on their parents' policies to age 26. So there were some things in it that I have to say, it's good to have, but better would be having everybody covered, period. And then you won't have to worry about whether you turn 26 and can't be on your parents' plan anymore, which by the way, they may not have if they get laid off.
We got to bring back Reed, T.R. Reed.
Yeah, he's great. He is great. Yeah, I think he's been here just twice now, but yeah, every time he comes, he's so inspiring. Yeah, he's great.
So it looks like it's almost time for us to wind down. How can our viewers find out more about these issues? How can they find out more about these issues in this?
Thank you for asking that. Thank you for that. So there's two ways, and the first one I would say is just go on the web and put in PNHP. Which
PNHP.
Is, yeah, PNHP, Physicians for National Health Program.
Yes.
And you will get access to the best database that I can think of that deals with healthcare issues and healthcare reform. They've got so many resources there you would not imagine it. The second thing I would say is, you know, if you want to ask one of the local PNHP people to come and talk to a group, a political group, a church group, a neighborhood association, whatever, we're happy to show up and do that. And the third thing would be to try to get our representatives and senators, actually we're lucky here in Portland because our representatives already signed on to the House bill, Representative Jayapal's bill, which is H.R. 1384. And that would establish a single-payer national health program if it were to pass. The Senate version of that is the one that Bernie Sanders has put up, and that's Senate Bill 1782. And I think just trying to beat on the doors and say, that's what we want to have. Let's do it. It's past time. We know how to do this. It's not like it's a secret.
You're talking about a different we than the we that I'm thinking about right now. I'm talking about the cult of Trump.
Well, that's true. But, you know, I think actually he even knows that it could work. But the problem is that he's got a lot of friends who are making just oodles and oodles of money in the current system. And I think he likes his friends a lot.
Well, I don't know. I would wish for something sad happening to him, but I can't do that because I'm a recovering Catholic and I can't wish for death.
Yeah, I don't wish that for him, but I would like to see him embarrassed.
He's incapable of being embarrassed.
Well, you know, I thought that about Mitch McConnell too, but you know,
wait a minute. Let's stop.
I recently heard that Mitch McConnell hates being called Moscow Mitch. It gets under his skin. So,
with that, I think we're going to finish because I want you to tell the viewers what you think about what's happened here this evening, or anything else that comes to mind now about what we're talking about.
I remember seeing David Letterman a few years ago, and he was talking to John McEnroe, the tennis player, who has a pretty notorious temper. And he said, you know, John, I'm really glad that you're doing tennis play-by-play now, because it's almost fun to hear somebody who knows what he's talking about shoot his mouth off. And so I figure, since this is something I really know about, I love having a chance to come and shoot my mouth off.
All right. Well, I want to say a few public service announcements here. And to learn about the nation, that publication that's been around for a long, long time in America. It's a left-leaning organization, liberal organization, and it's very, very important. And I want to tell you about the American Civil Liberties Union. Without the ACLU, our civil liberties would be further down the tubes. I've been a member of the ACLU for 4,000 years, or so it seems. And now the Alliance for Democracy, that's a national website for that organization that follows and monitors what's going on from the legitimate left on a nationwide basis. It's really very, very important. And we got to learn to end corporate personhood. Yeah, to say that corporations are not persons and money is not speech. We got to take back our Constitution. To learn how to end corporate personhood, go to www.movetoamend.org. Thanks for watching. And remember KFC and not Kentucky Fried Chicken. Dr. Don's KFC. Kind, friendly, and charitable. Be kind, be friendly, and be charitable to you too. And you too. And you too in the control room. Thank you for watching, and thanks for tuning in next time. Thank you. Goodbye.